The difference now is that in order to move safely back toward normalcy, Illinois, the United States, and frankly the whole world must contact trace on a never-before-seen scale. Contact tracing has played a role in our COVID-19 response since the earliest days of this pandemic, as local health departments around the state have aggressively sought out each COVID-positive person to identify all their close contacts and then encouraging those contacts to opt into monitoring programs and to follow recommendations. That was when we had a manageable number of cases and contacts that county health departments' existing staffs could handle. Of course, as we all know, over just the last few weeks, COVID-19 has reached a massive scale of spread statewide and nationwide, and existing public health management infrastructure simply can't keep pace. No doubt, as we all live through this pandemic, I think we'll all have a lot to consider about our failure to invest in public health in this country. But we'll save that conversation for another day. Right now, we have to deal with what's right in front of us, and that's getting to the other side of this crisis. Here in Illinois, we've had more than 50,000 known cases to date, largely in just a 60-day time frame. Their contacts are 50,000 sets of family, friends, coworkers, commuters, classmates, and other contacts. It's an unprecedented public health challenge, so we need an unprecedented solution to meet this moment. To do that, Illinois will be building on our existing infrastructure and expertise to shape a massive statewide contact tracing operation, gradually building over the coming weeks, and then scaling up an army of contact tracers by the hundreds and then by the thousands. Right now, based on our current rates of spread, we're looking at a benchmark that could approach 30 workers per 100,000 residents. But to be clear, that number can and will diminish if we see greater success in our public health measures, particularly our new face covering requirement. Already, we've identified groups of Illinois residents quickly willing to scale and be part of our efforts: undergraduate and graduate students, volunteers, retired health professionals, local health officials, community health workers, and new hires. And if you're interested in being a part of that, keep an eye out for more information on how to get involved in your community in the coming weeks. A significant part of this program involves technology. When an individual tests positive for COVID-19, a contact tracer will reach out to them through an app, through email, a text, or a phone call. And because not everybody can or will use technology, some will require follow-up even with a safe in-person visit if the COVID-positive person can't be reached in some other way. Then step 2. Interviewing the COVID-positive person, asking them to gather their contacts and retrace their steps over the past 14 days. This is what allows us to significantly slow the spread of the virus, because connecting with those who've been exposed allows us to do 3 important things. 1, notify them that they've recently been in proximity of someone who has tested positive. 2, recommend that they seek a test and self-isolate. And 3, offer them resources on how to access any needed assistance to prepare them for self-isolation. Things like alternative housing, food delivery, or medication. Privacy is an important aspect of maintaining trust in contact tracing. So to be clear, contacts will remain anonymous. Looking backward and pointing fingers doesn't help anyone in this situation. It's about what we do next to keep each other as healthy and safe as possible. Remember, we aren't reinventing the wheel here. Contact tracing has been done in every pandemic and major outbreak for many years. In fact, that's why Dr. Duffus is an experienced expert at it. And in a moment, I'll ask him to talk more about our efforts to build out contact tracing in Illinois. Finally, I want to take a moment to recognize a very extraordinary group of people. Today, the Illinois State Police, consisting of the finest troopers in the nation, will be welcoming 92 cadets into their ranks. 92 cadets who completed their training in the midst of a global pandemic will take their oath and join the ranks of our proud Illinois State Police. As these are unusual times, so too is this milestone. For the first time in the 98-year history of the ISP, there will be no graduation to celebrate the completion of their training. For the first time, there will be no class picture, no speeches, no family in the audience proudly watching them as they cross the stage and take their oath. And in the very act of accepting their mission in this way, at this time, these officers, these troopers, are launching their formal careers as members of the Illinois State Police as they will live it, in great service to us all and great sacrifice. When I became governor, I committed to rebuilding the ranks of our Illinois State Police, and these 92 cadets are helping fulfill that commitment. It's an investment in public safety that will serve the people of Illinois.
No one wants to hear that word. None of us want to hear it because we're all impatient, and we're deeply anxious and deeply desirous to start to turn the page and turn the corner with all the modifications that are required. The data is starting to give us more confidence, PPE, testing, our ability to begin very, very deliberative modifications and the progress of getting this guidance ready to deliver to counties, cities, and regions all across the state. And so that's a broad stroke. Forgive me, a little long-winded, but broad strokes update on an important day where we reflect essential and displaced workers and thank everybody out there for their hard work, their sacrifice. And again, I just wanted to thank in particular all of the folks that also are not part of that list but are more essential perhaps than any other. Those are the parents out there and all the uncompensated care that mothers in particular do every single day. May is a special month for other reasons. And I've said this, can't say it enough. We owe a particular debt to all our mothers, all the women out there that disproportionately are in this care economy that have just done heroic work, so often unrecognized, undervalued, I hope no more. But we cannot impress upon, I think, all of us cannot, I think, express enough our deep gratitude and respect to those mothers, those parents out there that are doing double duty right now with these schools being closed and all the extra work that is that we're all under in terms of heavy burden. So thank you as well, that group. And with that, happy to answer any questions.
Marisa Lagos, KQED.
Hi, thanks, Governor. I know that there has been a lawsuit filed by Orange County against the beach closure, or by some residents down there, and I wanted to see your reaction there. And if you have time, I'm also curious about sterilizations of masks, which you authorized in April. I'm hearing in San Francisco there's some pushbacks from unions who are concerned about the safety of that.
Yeah, I don't know specifically about a particular issue of what San Francisco is doing. I can just tell you what we announced a few weeks ago, and thank you for prompting this. We made a deal with a company called Battelle to put together a sterilization unit of N95 masks. The first one went up and is operational in and around Burbank in Southern California. There's a second unit that's coming to Northern California that quite literally as we speak is being set up. And to the extent that it's been FDA certified, to the extent that this technology has been around in the past, I can only offer this. One of those masks arrived that was sterilized off that line from Burbank today and was presented and shared with our team in our morning meeting. And it looks as new as any other mask. That said, I appreciate sterilization up to 20 times per mask is not everybody's first choice, and that's why we went out to get that large contract, and we are looking forward to getting many, many more of these N95 masks. I should just note, we have distributed, I don't know another state that can claim this, though I hope I'm wrong, because it'd be encouraging to hear of other states distributing over 44 million N95 masks, 44 million. But we'll need multiples even of that to meet the needs as we transition into the future in a post-COVID world. As it relates to the lawsuit, all I can say is it doesn't surprise me, and we'll see. Forgive me for saying this. We'll see what happens this afternoon.
Doug Sovereign, KCBS Radio.
Hi, Governor. Couple things. First of all, obviously you're keenly aware of protests going on all around the state and of the lawsuits being filed, multiple lawsuits. These folks are calling you a tyrant and a fascist, and you're being driven by ego, not by data. Can you make the case that you are, in fact, the decisions you're making are, in fact, being driven by data and science? And the posture we're seeing from you today, where you're being more optimistic, talking about days, not weeks, is still driven by that, as opposed to by the political pressure you seem possibly to be feeling today. And then second, you mentioned 2 days ago that there was going to be a further clarification in terms of the Bay Area this coming Monday, allowing groups of kids, 12 or fewer kids, to gather, not just in daycare, but in some additional settings. Have you gotten that clarification? Is that okay now with the state order in terms of what the Bay Area is planning to do on Monday?
Yeah, we're, in fact, across the spectrum, not just in terms of those numbers. Our team's been working hand in glove with the 6 counties and 1 individual city. So we are in line, and we're very pleased with that partnership and that progress. As it relates to the issue of data, every single day, Doug, I give you the data every single day at noon. I provide information every single week. We give you an update in terms of the indicators. We laid out specific indicators. We've been highlighting those indicators, drilling down more deeply on each indicator. We did one on testing and tracing and tracking and quarantine and isolation. We did one earlier this week specific to businesses and sectoral strategies, even regional strategies. And then I update you on the number of deaths every day. I update you on the number of PUIs and not just number of hospitalization and ICU patients. And you've seen those lines becoming stable. So that's given us some confidence. And that's why earlier this week on Monday, we didn't wait to respond to others.
Briefing. I'd like to begin today with a medical update from Dr. Ngazi.
For patients to isolate themselves and work with patients to identify people with whom the patients have been in close contact so the contact tracer can locate them. Fortunately, in Illinois, we're very resourced in terms of having experts to help guide us in this. So we're working with modelers from the University of Illinois, University of Chicago, and Northwestern, who have used simulation models and simple assumptions around key contact tracing parameters to approximate the daily number of caseworkers needed to perform contact tracing through the duration of shelter in place. Just to be clear, the actual number of staff needed is large and varies depending on several factors, including, but not limited to, care-seeking behavior, the daily number of cases, time from symptom onset to testing, the number of contacts identified, how quickly patients are isolated, contacts are notified and advised to stay home, self-monitor, and maintain social distance from others. And since these numbers change daily, certain assumptions are made in the calculations. So, for example, current prevalence. We assume that a staff works 5 days a week. We assume that a staff can make 20 phone calls each day. We assume that caseworkers will have 4 days over which they need to identify contacts. And this is a nearly optimal situation in which tracing begins 2 days after symptom onset, which is approximately 4 days after infectiousness. We assume each index case contacts 2 to 3 unique people per day. And this number would rapidly increase when shelter in place ends. For every positive test, there are 4 negative tests based on current cumulative test positivity rate of 23%. So the test needed is equal to the number of true symptomatic cases times 5. And this actual ratio is likely to rise once testing is further expanded. So in reference to the governor, we are using a benchmark of 30 workers per 100,000 population. Illinois has a population of 12.7 million residents approximately. So doing the math, 12.7 million divided by 100,000 gives 127. If the benchmark is 30, you multiply that out, you get 3,810 individuals as our estimate of how many individuals will be needed. However, note well that these individuals do not have to work continually because we're driving down the numbers testing positive because of the continuance or adherence to non-pharmaceutical interventions. They do not all have to be hired all at once, and so the numbers speak to the total over time. It is also very reasonable to start with an initial number, say 10% of that total, say 300 workers, but they're strategically placed in the regions that are most impacted. By working with the many individuals and institutions which I'll detail below, we will have the capability to surge as needed. Think of how we use a National Guardsman. Think of this as a dial and not a switch. Also, by deploying technology as a first contact with individuals, the number of workers needed will be fewer. We plan to implement a virtual call center, which will enhance efficiencies, and only the most hard-to-reach individuals will actually require a visit. So imagine a homeless individual, someone with no connectivity, or a very ill person. To always be on the leading edge of the pandemic, we've organized the IDPH staff into a command center of subject matter experts who are tasked with reviewing data daily and be ready to make recommendations based on chosen indicators of success, the umbrella. So who will be engaged to assist with contact tracing in Illinois? So contact tracing is a skill that can be performed by anyone who's bright, interested, and has a charming personality. We will hire people from every region of the state using mechanisms that are fast and enable quick onboarding. The core personnel for contact tracing efforts lies in three cadres. First, case investigators. These are the individuals, staff who reach out to individuals who soon after test results are reported as positive. Second cadre is contact tracers. They will call individuals who have been in close contact with a diagnosed case and ensure adherence to protocol and follow up as necessary. And the third cadre are resource coordinators. And these resource coordinators provide individuals on quarantine or who are isolated with the relevant resources and support to facilitate compliance with their orders. So food, medication, alternate housing, for example. So where are these people coming from? Well, we've heard from a lot of people who are interested. Professional contact tracers at local health departments, professional contact tracers from federally qualified health centers and community clinics, reassigned workers at local health departments, reassigned workers at federally qualified health centers, skilled community members such as community health workers, social service professionals, and other allied professionals. We have heard from recent graduates and students from public health training programs as well as allied health professional training programs. We have volunteers from Illinois Help who are interested, and there are also established as well as new training programs at regional training centers. To be done effectively, it requires people with standardized training and scripts, supervision, and access to social and medical support for patients and contacts. So what are some of the additional needs for contact tracing? Well, communication with the public is essential. To be successful, a community will need public awareness and understanding and acceptance of contact tracing and the need for contacts to separate themselves from others who are